Hi everyone, welcome to Medicine YouTube channel. In this video, we are going to see about Sjogrin syndrome. Sjogrin syndrome is a triad of dryness of eye, which is xerostomia, dry mouth, and rheumatoid arthritis. These three triad forms Sjogrin syndrome: dry mouth, dry eyes, and rheumatoid arthritis. There are two types of Sjogrin syndrome. They are primary Sjogrin syndrome and secondary Sjogrin syndrome. The primary Sjogrin syndrome leads to dryness of eye and dryness of mouth, which is a Sika complex. The secondary Sjogrin syndrome leads to dryness of eye, dryness of mouth, rheumatoid arthritis. Rheumatoid arthritis means that is painful swelling in the joints, and polyarthritis nodosa, polymyositis, systematic lupus erythematosus. These are the conditions of the secondary Sjogrin syndrome. It is known as Sjogrin syndrome because it is described by a scientist who is known as Henrik Sjogrin in 1933. The specific etiology is unknown, but the suggested etiology is due to genetic, hormonal, and some of the virus, which are Epstein-Barr virus, paramyxovirus, and cytomegalovirus. These are the three viruses which can cause Sjogrin syndrome. These are the suggested etiology, but the specific etiology is unknown. And another suggested etiology is autoimmune disorders. Now we will see about the clinical features of this Sjogrin syndrome. It affects mostly above 40 years of age. The females are mostly affected than males. The site is mostly parotid gland. The symptoms are dry eyes. Signs and symptoms. The signs and symptoms are dry eyes, xerophthalmia, keratoconjunctivitis, corneal ulceration, itching sensation, dry mouth, xerostomia, burning sensation, pain, caries, ulceration, cracks, or fissure of oral mucosa. Where there is dry eyes, which is xerophthalmia, keratoconjunctivitis leads to keratoconjunctivitis, and corneal ulceration may occur. There is itching sensation, dry mouth, which leads to xerostomia, there is burning sensation, pain, and caries associated in the mouth, and there is ulceration, crack, or fissures of oral mucosa is seen. The consequences. These signs and symptoms lead to consequences, which is dental caries and the perial disease. These are the consequences. Rheumatoid arthritis, joint pain associated with swelling, fever. Laboratory findings: presence of anti-salivary drug antibodies, presence of RA factor, elevated ESR level that is seen in the laboratory findings. There is presence of anti-salivary drug antibodies, and in radiographic findings, xylography is made. The xylography means they inject radiopaque dye into the salivary gland, and this dye has affinity for defective areas. When the radiopaque dye is injected into the salivary gland, this has an affinity for the defective areas. In this syndrome, the defective areas are acini, hence the dye spills the acinar defense. So the defective area of this Sjogrin syndrome are acinar cells. So that when we inject the dye, the acinar cells areas take up the dye, and this gives the appearance of cheesy blossom appearance or branchless fruit laden tree appearance. These are the two appearance which is seen in the laboratory findings. Now we will see the histopathology. The histopathology are intent infiltration of lymphocyte. There is intense infiltration of, there are more infiltration of lymphocytes are seen, replacing acini without damaging the architecture. And these lymphocytes replace the acini without damaging the architecture. The infiltration is so extensive it leads to atrophy of the gland. The infiltration which happens, the infiltration of the lymphocyte is so extensive, so it leads to the atrophy of the gland. The proliferation of the ductal epithelial and myoepithelial cells are seen, which leads to the formation of epimyothelial Icelands. These are the histologic features seen in the Sjogrin syndrome. Now we will see the treatment. Palliative therapy, which is symptomatic therapy. Artificial therapy, which is methylcellulose is given. Artificial saliva, carboxymethylcellulose is given for artificial saliva. Rheumatoid arthritis, due to the pain associated in the rheumatoid arthritis, analgesics is given. Thank you. That's all about the Sjogrin syndrome. We have all seen about the etiology, clinical features, laboratory findings, and histopathology and the treatment. If you like this video, please do like, share, and subscribe my YouTube channel. If you want more videos, please do subscribe my YouTube channel. If you have any doubt in it, please do comment in the comment box. If you want any other topic to be suggested, please do suggest in the comment box. Thank you. Please do subscribe.